Assalamu alaikum, the communication day. First scenario, Mr. Khan, who has advanced dementia and relies on a hoist for mobility, was admitted to the hospital with aspiration pneumonia. Despite receiving treatment, he still requires high flow oxygen. An end of life care plan has been discussed with his son, Mr. Jack, the next of kin. Please address his concerns and responses accordingly. Ready, Dr. Ala?
Yes, I'm ready. Yes.
Okay, here you go.
Okay. Hello. My name is Dr. Ada. I'm one of the doctors in the ward today. May I confirm that you are Mr. Jack? You are next of kin of Mr. Khan?
Yes, doctor.
Okay. Mr. Jack, we are meeting today to discuss your father or grandfather.
Father.
Okay. Discuss your father's health condition. Is that okay with you?
Yes.
Okay. Would you like anyone to attend the meeting with us?
No, I'm okay.
Okay. May I ask you, firstly, how much do you know about your father's condition so far?
Yes, doctor. I know that he has this dementia, and he's like end of his part of his dementia state, and he has aspiration. They said that he had pneumonia, and it's most probably because he's aspirating, and we are here for treatment.
Okay. And do you have any expectation about your father's care and condition?
Yeah, I hope that he go through this hard time and go back home.
Okay, Mr. Khan, I'm really sorry I'm not having good news for you today.
Mm-hmm. What you
So your father has been admitted with us with soreness in his lung due to his problems, his memory problem, and he got what we call aspiration pneumonia, which occurs due to the food goes the wrong way. Instead of going through his food pipe, it goes to his air passage and cause many problems in his lung, difficulty in breathing, and maybe to a degree that can be life-threatening. Are you following me?
Yes, doctor, I understand that he has this aspiration pneumonia because he has been admitted to the hospital several times with the same cause, but several times hopefully ended by we go back home.
Okay. We started treatment for his condition, but unfortunately, because of his frailty and his advanced condition, the recovery rate in such conditions is very low. I'm really sorry for delivering this.
Mm-hmm. Okay, so I know that his recovery is not that fast, always like this. He's always have this problem, and it took time, not like normal people. If there is any new about that?
Yes, after evaluation of his condition now, the treating team thinks that the rate of recovery to him is very low. And I'm sorry to say that in case his heart stop, uh, we may have two options in any patient. First, we start to do a resuscitation to stimulate the heart to beat again through firm chest compression and insertion of a tube into his main air passage, and to be attached to a machine to assist his breathing. Are you following me?
Yes.
Okay. Will this process have a lot of complication, like fractures of his bone or bleeding in his lung or deformity to his chest wall, and also carries a risk of acquiring lung infection with resistant bug, which could be very difficult to be treated.
Mhm.
Uh, all of this will add more complication according to his, and this will only make him, this will prolong his suffer more.
Mhm.
So,
Yes.
so the treating team
Mm.
in his condition decided not to do this procedure, not to do this process in the best interest of his condition, and gave him a peaceful way to go while maintain his dignity. Does this make sense for you?
Doctor, are you talking about DNCPR?
Yes.
He has DNCPR in the community, and we agree this for a long time ago. So we are okay with that.
Okay.
Mhm.
آه، هي ما كانتش مكتوبة في it wasn't written in the case.
Okay. EOL, unit end of life care.
Yes.
Yeah, carry on,
Mhm.
Dr. Ala. Continue, yes.
Okay. So we are not suspecting him to have too much time, and our priority now is to keep him comfortable as much as possible and not to suffer.
Mhm.
Uh, does this make sense for you?
I couldn't understand. What do you mean?
Uh, I missed the case, I think.
Continue. You can follow.
Um, I go to the DNR, not end of life. I think
You can follow.
we
You
have
can follow.
overlapped.
Okay, continue what you have started. Just carry on.
Okay.
You will catch. You will catch.
Okay. So as I told you, our priority now is to keep him comfortable as much as possible and not to suffer in this difficult time, as uh, we don't think he will recover from this.
So you give up on my father.
No, it doesn't mean that we are giving him up. As long as your father's heart is beating, he will be offered all the medical care. But now we are shifting the type of care we are supporting, we are providing for your father. Our care now is to uh, keep him comfortable and not to prolong his suffer.
So what
Is
does
that
that mean? Maybe I couldn't understand. What do you mean, doctor? So what do you mean exactly by not suffering? Keep his suffering things.
2
So you will
minutes
keep
left.
treat him. You will keep treating him.
uh, uh, yes, our priority now is just to give him some potent painkiller to keep him pain-free.
Mhm.
Uh, um, mm, right.
Mhm. Okay, so you will keep him pain free. I'm totally agree. I'm okay with that.
Okay. Uh, okay. Dr. Basim,
Okay,
it's okay.
Dr. Ala, forget about the task now. You have 1 minute and 10 seconds. What you will do? What you will ask? Forget about the patient.
Okay, I will ask about the social
Yes,
history.
do it. Okay, so
Okay.
continue.
Okay, may I ask you some private question if you don't mind?
Okay.
Okay, was there anyone depending on your father?
No one.
Okay. Do you need any kind of support we can offer you in this difficult time?
I'm okay. I just need to support my father.
Okay. Uh, we will try to do this, and I will give you the contact number of our department to update you about your father's condition if we have any update. Okay.
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 Oh,
I missed the case, Dr.
oh,
Basim.
what leaflet and brochure you can provide to this patient, to this surrogate now, or to the son? What leaflet or information about what? Okay,
Um,
okay, time is up.
uh,
You didn't read the scenario, or you read it and you missed something inside?
I think I missed something. I misinterrupted the scenario.
You are
Maybe.
not miss something. You are in the right direction. You need to be sure that there
Yeah.
is the NCPR or no. But I think the way you take it, you take the long way. If you just ask, I will reply for you, and you will save the time.
Okay.
Because this patient, yeah, I understand that you understand the case, that before discussing EUL, you need to make sure that the patient in the first place has DNCPR. If you ask me this question directly, anyone discussed with you before uh, to not resuscitate, is he has any, if you ask me directly, I will say yes, he has community DNCPR. So every scenario of EOL, no one will discuss end of life care unless there is DNCPR already there in the file of the patient.
Okay.
Okay, so just ask for it, and if the patient have no the patient have no DNCPR, you will discuss the DNCPR first. You'll go this pathway, but if you ask, I will tell, and you move to the real scenario that you need to discuss the end of life care.
Okay. I just misinterrupted the scenario.
Don't worry, Doctor Ala. You started well and you explained part of the task. I don't know why you
Okay.
stopped. You explained already what you want to be explained in this scenario. You got it? I think Dr. Maeda also agree with that. Right, Dr. Maeda?
In what? Sorry.
And part of his task to talk about DNAR or the not
Yeah, yeah,
resuscitate.
yeah. He's right to start to talk about the NCPR. But in these scenarios, normally when the patient have end of life care, they in their file already the DNCPR will be there. So you need to ask the surrogate or the next of kin about if there is anyone discussed with you before the resuscitation issues. Explore if if they already has been discussed with him, he will tell you, and if not, you need to discuss at that time. But you go through the long pathway. You start to discuss the issues and everything before you understand if the patients have already DNCPR or no. That's why the scenario become more longer for you, and you think that you missed the case.
Okay.
But you understand what to do. You understand that
Yes.
ENCPR is important before EUL.
Yeah. And I hope you will not stop talking in the scenario in the exam. Do whatever you have to do till the end and let the examiner judge whatever you did. Don't stop for any reason.
Okay.
You might be interrupted with new idea, but again, if the examiner asks for you, you will not get the case as a marks. So continue what you started till the end and let him judge. You started well, the introduction, you can gain a lot of marks. Don't depend on the main task to be satisfied by the surrogate, as in this scenario. You are waiting for her to tell you, okay, doctor, that's okay for my father. No, don't think she will accept the idea from first time. Sometimes you cannot convince and she will argue with you, she will resist. So what you will do, you will stop convincing her. If you have stuck in this scenario or this situation, you can suggest a meeting with the consultant and you can gain a lot of marks as well, right? You cannot
Oh,
explain and she is not accepting the idea. Okay, let's have another meeting with my consultant. Jump to the task of the social support and the care for the family, because you are talking about end of life. The patient might die after a couple of minutes or hours or whatsoever. Let's talk about the end of life care itself. As Dr. Maida said, one of the component is it is the do not resuscitate. Yeah, definitely. But I prefer to start explaining the task as end of life care. Have you ever heard about it? You start to prepare the patient that he has pneumonia, aspiration, explaining how it happened, the food going the wrong way, and so on. But if you try to start with the end of life care, which is your task, I guess it would be more easier. Let's do it. For example, you are Mrs. X. You are the next of kin. Yes. Do you want anyone to attend? Yes. Agree to attend or to invite someone here, because already he is dementic and lost, of course, the capacity. He is dying. So someone will support him or her in this meeting. I'm so sorry, I don't have good news for you today. Your father planned has it changed to the what's called end of life care. Have you ever heard about this? No, doctor, I never heard about end of life care. But at least she will know, and she can understand there is some thing will be ended, which is the care from the word itself. No, doctor, please explain for me. End of life care means that one, two, three, four. Your father support will be just for supportive care, the last moment of his life, just to let him die in peace, provided that he will be pain free, along with maintaining his dignity. We don't want him to suffer more. He already suffered because of, you can mention what he has, pneumonia, aspiration, and whatever you want to say. That's why, in the best interest of his condition, the consultant and the team decided that he shouldn't be for further active management. You give up for my father management. I'm so sorry to say, it's not. It's somehow, yes, never. Sorry, give up. But we want him to die in peace. Not to suffer more as or he already suffered. You know, he has admitted before for many reasons, for many disease, and so on. This is what I prefer to do. Plus, explaining, do not resuscitate. And in this condition, if your father heart stop beating, we will not jump to his chest to do compression or heart massage. So we will be sure that his dignity is maintained. This is my opinion. Anyone has suggestion, or Dr. Mayada, of course, this is your case. What you want to say, you can say it now, please.
Okay, so I think in the if you let's start from the beginning. I can see that you are understanding the case from the start. You understand the case, so don't judge yourself that you are not understanding the case. Just the only thing that you don't know how to enter the case. That's it. This is was your problem at that time. In the first, if you are was listening to the patient is understanding. When you ask me what I understand about my father condition, if you listen to my word, I told you aspiration pneumonia. That means this patient knows it is aspiration pneumonia. He knows the word. Why he knows it? Because this patient has a experience. The patient, the co-patient, I mean the next of kin, have recurrent. The patient had recurrent admission to the hospital, and the family knows about the diagnosis. It is aspiration pneumonia. So they go through this scenario several times. I think you don't need to explain to me more about aspiration pneumonia, that it is go to the other gut, and because I know you understand my point. So from here, you don't need in the first place to take a lot of time to explain to me that it is aspiration pneumonia, how it is. I mean, it's go to the wrong direction and this issue, because I already understand. You start from there. That's why we are check the understanding of the surrogate or the patient. So we understand, we know exactly where the level of knowledge, and then we build over. Okay, in this scenario, this co-patient already know this is spiration pneumonia. What next? Then the next is that despite the active treatment we are giving for your father, unfortunately, he is not responding well. That means we need to we need to make sure that we keep him comfortable. It's a part of our care to keep our patient comfortable as far as we can, mainly when they reach their end of life. Then you ask the patient, what do you know about the care on in end of life? I don't know anything. Then you will explain what is the end of life care. It means that we will stop all the active medication, even the antibiotic, and we just concentrate. Even the nurse will not check his vital signs. We just concentrate to keep him comfortable in during the end of his life by giving him medication for pain, medication for secretions, medication for to keep him relaxed. After that, you discuss this is what does it mean. Then you see what is the reaction of the patient. I don't want this and whatever, and you according to what happened after that. Then if you touch the issue of the DNCPR, in order to do that, as far as we are thinking that this is the end of life, is your father have DNCPR? Then you ask about this. If he said yes, he had it, that's the end of it. If he didn't have, then to discuss with him the DNCPR and everything. And then you go to the advanced directive thing, because you need to know about his father wishes. If when he reached the end of life, he has any advanced that, because he has advanced dementia before having this end of his stage, he has any advanced directive, he has any wishes, he has any nominate anyone to be lasting power of attorney. Is in the end of stage of his life where he want to be die. He want to die at hospital or hospice, or he want to go to home. He want to go to his whatever, what he wishes. Because if he has a specific religious, this patient has any specific religious, he need someone to attend while he's dying, all these things. And then you tell the family that there is opening hour for visiting the patient while he's in the hospital, and everyone, and also there is a for parking cars, it's open for them. You tell them that if they need graving, what do we call the graphing office, that to support them if they need that. So
Privacy? Yeah, for the privacy, you mean?
not privacy, I mean
Restroom?
graving office.
Ah, okay.
So to support them during this hard time. So you tell the scenario of isn't you enter the scenario of EOL. Okay.
Yeah, bereavement team also one of the teams can
Yeah.
be offered here.
Bereavement.
Yes.
I'm graphing. I'm saying graphing bereavement team.
Ah, okay. So you mean the team? Yeah, yeah, sure, sure. Okay, and the support as well, as already Dr. Ala did. But again, as advice, as Dr. Mayada said, just follow what you have been started, whatever the performance. Some candidate, by the way, they did in themselves bad, and they score high. And sometimes the opposite. You thought that you are doing the best, and the score will be not good. So it's not depending on your performance, it depends on the examiner. He might like what you did, so continue, go ahead, don't stop. And others maybe judging the opposite. So again, the advice is continue. You are understanding the scenario. Continue what you have been started through. Okay, Dr. Ala?
Okay.
Yeah. And
Okay, I will
you
send
have good confidence. By the way, you have good confidence, you are calm. So use this in the exam. You can do any scenario.
okay. I
Okay.
will send the scenario now for Dr. Mayeta.
Yes, please.
Okay.
Yeah. Okay.
So,
Dr. Hassan asked, explain the team mentioned. Bereavement team, the team who's having a assignment to sit with the family just to support them socially, emotionally. Sometimes, as Dr. Maid said, even spiritual, they can call for religious team to sit with the patient. Like in our Islam, you can invite someone to read Quran. So according to the religious behavior or beliefs for this patient, you can invite someone. There is a specific team, by the way, in Europe for this task. But in our culture, you can bring someone to read, for example, Quran on them. This is the idea of bereavement team and the spiritual team. The spiritual team, which is assigned for the religious issue. At the bereavement team, the team who can support them emotionally and socially, because they are losing the father or the beloved person. He will die definitely. And one of the concern, Dr. Ala, be careful. When my father will die, or after how long? So be ready for the answer according to the task. If they wrote hours, so you will say it's hours, matter of hours. If it is minute, it is a matter of minutes, according to the scenario. I mean, okay.
okay.
Okay. So your scenario for Dr. Maida.
Okay, I will send it now.
Okay. Okay. If the son had lasting power of attorney and he refused end of life care, this is what I'm afraid of. If you have asked this question, he might argue with you, no, doctor, do everything for my father. And by the way, it's a real scenario or a real situation. You will sit with the son, for example, and you will tell him, oh my God, we already decided we cannot do anything for him. He's not responding, and so on. You are explaining the end of life care or palliative or whatever, and he will tell you, no, doctor, please do everything for my father. He's the one supporting us. I need him whatsoever. So you'll be in trouble. In this situation, either I prefer not to give him the option to explain or to express that he is having the power to decide, or if he asks to do the opposite, tell him, but it will be like argument. He will tell him it's a medical decision, just we are informing you. Again, he will argue with you. So for me, I will close this door totally. I will not ask who's having the lasting power of attorney, or in another way, who's taking decision on behalf of him. Now we are deciding for something. It's not for discussion. It's for decision. So it's better not to ask him if he has power to take decision. I prefer to ask only about advanced directive. And for the advanced directive, we respect the patient wishes according also. If it is going with the medical decision, we will continue it. And suppose all old patient or elderly patient, they wish to die at home. They will not give advance like that. Do everything for me. I need to be alive until 100, for example. No, most of them, they are preferring and choosing to die in peace, either at home or without compression, without tubes, without surgery. Some patients even they don't prefer to go to the hospital at all. So absolutely die at home without any intervention. This is regarding the point of lasting lobotomy. Is it clear, Dr. Muhammad Omar? Okay, your scenario, Dr.
Thank
Maida.
you very much.
Okay, most welcome. You are the doctor in the gastroenterology department. The scenario, Mrs. Hannah, 35 years old. She has recurrent dyspepsia and upper gastrointestinal endoscopy, was advised to undergo it. She was admitted, and after fasting for 6 hours of food, they informed her that the upper endoscopy was cancelled due to an emergency hematemesis crisis or hematemesis case. Sorry. Please talk with her about what's happened, and as she is angry. Sorry, as she's angry, the task. Please talk with her regarding her condition and answer all of her concerns. Dr. Mayada, good luck. We'll give you 2 minutes. I will copy the scenario in the chat box. Any question regarding previous scenario? By the way, I want to add just this comment. End of life care is a term for many variety of cases. So you might have end of life care for cancer patient, for aspiration, motor neuron disease, stroke, a patient with the hemorrhage, coma, dementia. So it's a big term and big task and basis, whatever the underlying pathology. Be ready for any of them, but the same term and the same purpose. You have to explain the end of life care. Okay? And be sure that they do not resuscitate one of the component in this task. You should explain or give idea that the patient will not be resuscitated if his heart stopped. Ready, Dr. Maida?
Yes, sorry.
Okay, here you go.
Her name is Hannah. Okay.
Yes.
Okay. We'll start now. Start?
Yes, here you go.
Okay.
Yep.
Hello, good morning, Miss Hannah. My name is Dr. Maida from the GI team. First, I want to sincerely apologize for the disturbance happened to your procedure today.
Well, doctor, I have been waiting for hours and I have been fasting. How is that happen?
Mhm. I completely understand how frustrating this must be, especially after preparing and fasting for 6 hours. Is that okay to explain why this happened?
Yes, please. I wanted to know.
I really appreciate that, and I'm really sorry about what you're going through. What happened was that an emergency case came in, a patient with a life-threatening uh, bleeding from his gut. It required immediate intervention to stop the bleeding and stabilize him. Unfortunately, that meant the endoscopy room and staff were fully occupied unexpectedly.
And why couldn't you inform me earlier?
Okay, as I told you, that's happened very urgently, and we go through this go through this, and unfortunately, we cancel your procedure at this life-threatening one, and so we this is was unexpected to happen.
Well, am I not important enough for you?
Absolutely, you are important, very important, and your case is very important as well. We recommend the endoscopy because of your recurrent problem with dyspepsia, and we want to ensure there is no underlying issues like ulcers or anything. You absolutely deserve time care. Emergency like today are rare, but they do sometimes shift the schedule, not because your case is less important, but because someone life was in immediate danger.
Okay. Will this delay will affect my condition?
Okay. Uh, Firstly, let me explain for you what we did to make sure that we are not delaying your procedure a lot. We have already spoken with this casual team to prioritize to prioritizing you and rescheduling you. And if you are able to stay, we can aim to do the endoscopy for tomorrow morning as first case. Is that okay?
So it will be in the morning.
We can do this in the morning tomorrow. And if you can stay in the hospital, and if you can't, we can work together to rebook it as soon as possible, as far as you are available within the next few
Okay.
days.
Doctor, what if it gets worse again before my next appointment?
Mhm. I completely understand that, but we need to reassure you that if we are waiting for tomorrow or next day, it will not be that, it will not change a lot the condition. And as I told you, this is a for to know exactly what is the case, and this condition not happen a lot. It's rarely happen, and unfortunately, that's what happened to you today.
Okay, doctor, but now all this wasted. I took time off from work and arranged a child care. Now all of this wasted now because of you.
I completely hearing you. I understand that it's a frustrating and it's really hard. However, we can still schedule. We can give you another. We can arrange with give you a day off from the work by giving you sick leave, and we can also even. Do you have any family or any member can help in the child care issue?
No, I arranged for it.
Mm-hmm. Okay. Uh, is that okay if you can uh, rearrange that, and in your available time we can schedule your endoscopy as well?
Okay, I will try.
Okay. How generally you feel about your condition at the moment?
Well, I'm still suffering and I don't have answers yet to my condition.
Mhm. Okay, I'm really apologize. Things can happen, and it's out of our hands. And I highly appreciate that you accept our apology.
Okay, doctor.
Okay. So if you want, you can stay in the hospital. If things is okay for you, you can still stay in the hospital for today, and we can arrange this in the early morning. And how this sound for you?
I think I will need some time to think about it.
Okay. Okay. So what we're gonna do now, as this cancelled for today, we'll start. You will restart eating, and when we reschedule the endoscopy, at that time you need to be fasting at least 6 hours before the endoscopy. Is that sound good for you?
Okay, that's fine.
Okay. Do you have any concern?
No.
Okay. And okay, I will wait for your time. I will wait for you, and whatever your decision, just update us about what you want to do, and then we'll go from there. Okay?
Okay. The scenario will end early, I know.
Sorry?
Yes, yes, continue, please.
If you have any concern, you can just tell me.
Okay, okay.
Do you, okay. 2
4 minutes, 3
minutes.
minutes.
3 minutes, okay.
3 minutes only. So, what you want to add, Dr. Maida here?
Okay, so I just let me uh, summarize what we are saying now. And summarize not okay. Just make
Okay,
sure that
before summarizing, what's important here to be addressed? What do you think?
really, I will not ask about smoking, whatever. I will not ask here. I will not ask. Okay, do you have anyone to take you home?
No.
Okay, and I understand the okay. Do you want any help from our side?
I want maybe some help with child care. I arranged for it, but now it is canceled now.
Okay, I think we can help you with the
Okay,
child.
2 minutes left.
We can help you with the child issue uh, by we can advise around some nursery hours. We can give some free nursery hours, so you can keep your child at that at that period of time. This is the we can help you with that, and that's it.
Okay, thank you.
Okay, thank you. Do you have any more concern? Good
No.
concern. Yeah. Okay. Okay. Do you have anyone to take you home?
No.
Okay.
It's
So
okay. It's okay.
about the procedure, I can give you some brochure and so to um, learn more about this procedure. Okay. I think
Okay.
already someone discussed with you the procedure and the importance of this for your diagnosis, and you already have the consent before having the procedure, isn't it? Am I
Uh,
right?
yes, you are.
Okay, thank you.
Thank you.
لا أنا حاولت إني أجرجر الموضوع هو ما عنده أي حاجة.
So, you deny the importance of social here, the smoking alcohol?
Smoking alcohol at the moment with angry patient, it's just a.
I
I
think
will
it
not
is
touch.
relevant for it.
I will not touch it.
Why? Why? It's you have sometimes. If you don't have time, okay. But it's
No,
related to the case, right?
uh,
Even if she's angry.
I don't know. But
Anyway, time is
an
up.
angry patient, angry
Yeah,
patient, I
why
will
not?
not touch
Why not?
this thing.
By the way, direct or indirect effect of smoking on the peptic ulcer, there is, right? The
It's
alcohol,
not
this.
about the peptic ulcer
But
thing. It's about
I
the
think
task. It's
I
about the
No?
think
task. So
the
the task,
scenario
she's
is
angry
about
that
mentioning.
there is the endoscopy thing that she's angry about. She's not angry either. If she's angry, I will not have a time. But she's not angry. This is the issue. This is the issue. The patient was not angry.
You started the scenario very early and ended early as
Okay. First of all, why I start this way? If I start by who are you, she will get angry because I know this patient and we have discussion with her before, and now she come for her endoscopy things. So I know the patient.
But I think in any scenario, you should confirm the patient first and confirm agenda. Then you go.
Um, don't know, an angry patient, I need to know the patient. Or maybe you are right, but if are you Miss an angry patient, I feel like he will get more angry because you don't know him.
By the way, she will be angry all the scenario, not only at the introduction. So you know how to convince and to satisfy her concerns. This is your task, but not to ignore the main skeleton of the communication scenario, the confirmation, introduction. You should do this all. Okay, let's hear
Yes.
Dr. Ala comment, then I will.
I think she did really great, but just the time frame she gave, I don't think this is a good idea to give any time frame in this case. We should say just as soon as possible, and we will arrange for this, and so on. But she gave time frame for morning or tomorrow. I'm not sure about this idea.
Yeah, I agree with you. You don't know the schedule of OR or endoscopy unit. If you give means that you are the one leading this unit, and you are not the one leading this unit. By any way, you just have a meeting with this patient. You will try your best to be as soon as possible, but you don't have any guarantee she will be in the first list morning or tomorrow afternoon, maybe today. Just tell her as soon as possible, as much as we can.
Right.
Right? Okay, continue, Dr. Ale.
That's it. About the concern, she did really well.
Okay, from your side as preparing the scenario, do you think the alcohol smoking was mentioned or no?
No, I don't think
Or
so, because the scenario here is about the procedure itself, not about counseling about the hair dyspepsia. So I don't. I think it is irrelevant here.
okay, for
But it
me,
could be mentioned because she had time, a very long time.
I
blood,
think in
yeah,
this time I can use it for safe netting.
Yes, safe
It's
netting could be
yeah,
also.
safe
okay,
netting it will
perfect,
be
perfect,
important.
Dr.
Yeah,
Maida. What
yeah.
do you think the safety netting in this scenario?
So if she has bleeding, if she have black stool, if she has like palpitations, something,
Yes,
any abnormal
you
symptoms
could
out of
mention
her
something about
normal, so it will be this. I think I will use this time for that. It will be more
Perfect.
better.
What about the reason behind this peptic ulcer? Whatever the reason. I mean, if there is hidden reason in the scenario, you will not give advice through it.
Yeah, I will give advice about if she had any pain or to not use non-steroidal anti-inflammatory drugs, medications, or any hair pills without. Uh, because as you said, I don't know when I will do the procedure. So during this time and until she had the procedure, I will advise things that she don't need to take, like non-steroidal anti-inflammatory drugs, and she need to take her medication, omeprazole or whatever, and BBI regularly. And if there is any
we can
symptoms, yeah.
we can mention smoking and alcohol here.
Smoking and
Yeah,
alcohol.
this is my opinion. Smoking, one of the risk factor for peptic ulcer, plus alcohol, right?
Yes.
Yeah,
For the safety netting.
as a
Yeah,
safety netting,
can be,
exactly. It's
can be,
not.
can be. Yeah.
It's yeah,
Like
it's related.
try to avoid alcohol at this until we have the. But why?
Yeah,
You
why
feel
not?
why?
It's the point is why not? But it's relevant, right? I'm trying to convince you. By the way, Dr. Maida, it's related, and you said I will give her safety netting. One of these points to be in safety netting, don't do the main trigger of your disease. Maybe
Uh,
her disease
okay.
related to
So
stress,
smoking or
maybe
alcohol.
due
Yeah.
to
Yeah. Right.
exactly.
Yeah. Right. Agree. Mm.
By the way, I'm
From this
asking
part.
to do
From this
this
part.
if you have time. If you have time only. Yes, yes, from this part. Of course, I am asking through this part
Yeah.
because peptic ulcer and dyspepsia related to this, maybe
Mm.
because of smoking.
Yeah.
But I agree if you have time. If you don't have time,
Mm.
you fulfill the all parts and the task completely, and you don't have time to ask for social. It's okay.
Mm.
But if you have 3 minutes instead of
Mm.
summarizing with angry patient, by the way, you are summarizing what happened with angry patient, so you are irritating here again. We have missed your appointment because of another patient. Oh, doctor, don't remind me, doctor. You are remind me again about what happened and make me angry already before, right? Don't
Mm.
summarize in three scenarios. And one of them, the angry person, and medical error, and breaking bad news, right? No need to summarize. He already injured and shocked by the meeting
Mm.
agenda.
Mm.
Agree now?
Yes.
Okay. Yeah. Any other point, Dr. Ala?
No, no, she did well.
Yeah. So again, as a timing, no need to mention specific time because you don't know the schedule. But the good thing, Dr. Maida, you mentioned we have an action. This is what I like in your performance. We had an action, which are we already reschedule you again, give you another appointment, and this appointment will be as soon as possible in this way, not tomorrow morning. You don't know what will happen tomorrow morning. She might have another postpone because of another patient, so we will do it as soon as possible. Before that, you have to be fasting, as you mentioned exactly. You can break your fasting now, and before the procedure, we'll let you know 6 hours prior to the procedure to be fasting again in this way. Okay. Otherwise, I think you cover it well. You convince her, and also good thing to ask. How are you? What do you feel now? Initially, I mean. Welcome, Mrs. Hannah. How do you feel now? Are you okay? If you want to calm her down, then confirm her name and age and carry on. Clear?
Yes.
Okay. Any question or comment, Dr. Maida, Dr. Ala, for this scenario or the previous scenario?
No, this scenario is easy, but just we work with the skeleton of the case, of any case. Yeah.
Yeah, I agree. There is some easy scenarios, but with these easy scenarios, you might have an tough examiner. So whatever you will do, he might minus you. So don't assume the scenario is easy. I can gain the full mark or a lot of marks. Some examiner, as I said, with easy scenario, they can minus you. I prefer to have hard scenario with a kind examiner, for example. Not easy with stuff examiner. Really, hopefully you will face this kind of examiner, either kind and fair, not the tough and toxic one. Okay.
Inshallah.
Any other question or comment? Hopefully, inshallah. Any comment or discussion point to be raised? Any question, doubt, suggestion? Okay, we'll read the
ممكن
comments quickly. Yes.
regarding the first scenario طبعا written in the scenario that the end of life care is already discussed with the daughter of the patient. So what is the task of that scenario يعني to repeat or to try to convince or what يعني can you explain please for this?
No, Dr. Maida saying maybe some patients already have been discussed about not to
The
resuscitate, for
DNCPR,
example.
not the EOL. Your
Yes, not
scenario is
EOL.
EOL, but the DNCPR either discuss already because you can't. My point is that you can't discuss EUL unless DNCPR in place. Okay, so either this patient DNCPR already in place and they didn't tell you, so you ask the patient, and if they didn't discuss with him, then your task now to discuss the DNCPR as well. In this case, it's just EUL to discuss EUL.
يعني
Yeah,
that
but
you mean the
BRD, you might have
palliative care
End of life care. End of life care.
no. He's assuming that this patient was for palliative care earlier, and now he's for end of life. Yes, it might be like
End of
this,
life.
doctor. Yes, the patient might be for palliative earlier,
yes.
and when they found this patient is not responding anymore, this is the time for end of life care. And by the way, this is the same manner of our management plan. They are starting with active management. Okay, everything will be provided for the patient. Then they will try to withdraw some of the active management. For example, not necessary, but I mean in any scenario, you might have patient with cancer, for example. First, they give him the whole lines of management, radio, chemo, and surgical. Then they narrow the management plan more. They, for example, remove the surgical management from the plan because it's spread everywhere, metastasize. So they cannot remove by surgery. Then next, they found that it's not even responding to the radiotherapy. They can narrow it to palliative only, palliative, giving the antibiotics, giving support, giving antidepressant, antibiotic I mentioned, fluid, feeding. Then he's not responding. Then now they are more narrowing to end of life care as he's not responding to any antibiotics. So they will stop the antibiotics, they will stop the antidepressant, they will stop all the active management. What they will provide him in the end of life care, maybe some painkiller just to keep him calm, and in some scenarios, IV fluid. Even sometimes they are stopping IV fluid. So this is the way how it start as wide, then narrowing till the end of life care. Maybe this is the last and the smallest circle in the management plan. You got it?
Yes.
Okay.
Thank you very much.
Most welcome, Dr. Ahmed. Okay, another question or comment. Also, no need to keep patient at hospital. Dr. Nusaiba is saying. About what patient? The one for endoscopy? I think he need to be in the hospital. Dr. Hatim wrote, I think it's important to speak about smoking alcohol, agree, because we are not sure when she will have the endoscopy. So the condition may deteriorate. So it is logic to advise her to stop till she have the endoscopy. Not only that, she might have the endoscopy and for example, the ulcer treated, managed, controlled, and the patient will go back to the smoking, the alcohol, the same trigger, the same cycle, and he will be admitted again with peptic ulcer. Maybe next time he will bleed and he might be in hypovolemic or hemorrhagic shock, either life-threatening or he might survive or not. So it would be the same reason of his recurrent admission plus maybe life-threatening condition. That's why I believe we should advise regarding the trigger or the cause of his admission. In angry patient, Dr. Sarah, in angry patient, the recap is not preferable. Agree 100%. But other part of the communication is important. Absolutely right. Smoking, alcohol are yes, Dr. Sarah, I agree. Self-knitting, any symptoms, of course, you can give at the end. Please, if you feel severe tummy pain, severe discomfort in your tummy, passing a lot of blood, pale than expected, someone told you you are paler than before. For all this, you can ask medical advice. It's okay to mention a specific time. As she said, we will reschedule, put you in the list. We already discussed this. It's not necessary to give frame time. Just give him as soon as we can. This is, I think, the all comments. Anyone has another comment? Any doubt? Any question? Any suggestion? Dr. Muhammad Omar. Thank you. After canceling the procedure, I mean, she can go home till reschedule again. It depends on the case scenario. Some patient with bleeding ulcer, okay, it was cancelled today, but still she will receive blood. She might have melena overnight, although it's better, but still she has. By the way, melena is not an active bleeding. Melena residual for previously bleeded ulcer, right? So it's not necessary to be an active bleeding now. Hematemesis is the one active bleeding. Even the patient will not have active bleeding, hematemesis, I mean, he might have melena for residual effects or residual bleeding from the ulcer. So it's not the matter of discharging or not discharging. I don't think there is endoscopy to be done electively, unless, for example, biopsy for ulcerative colitis, for example, or for celiac disease, diagnostic, I mean. But you don't know what the condition here was in peptic ulcer, right? I don't think the peptic ulcer can be postponed. Should be managed as soon as possible. So it's I think it's not accepted to let her go home. She might bleed again. She would come back with hemorrhagic shock or life-threatening condition. I don't think this is a wise idea to do it or to say it. Sometimes they are arguing with the patient not to leave the hospital. She will tell you, no, doctor, I want to leave because of, for example, party, for appointment with my son, with my girlfriend, or whosoever. But you have to convince her because she might have this bleeding again and she will come back with a life-threatening condition. If she insists to leave, yes, this is her right, but you have to let her sign what's called DAMA paper. Why? Because anything will happen, it would be her responsibility. After explaining also the benefit and the risk of leaving the hospital. Okay?
The point when he mentioned that he has, I think, a daughter, he should be staying with her like that. Just Dr. Mayada, don't offer directly that you will support this. You should offer some solution from the side of the patient first. So it is not the usual that the hospital will support everyone having problem social, but you will suggest first that if you have relative or anyone can care, or she can go to any other one take care of her. You should suggest first about how he can manage his issues. If nothing, or he said, I have no one, or all the ones I know it is far away, or she is young, or something really you need social support, you will offer. So it's not the first thing is we will offer the social in anyone have a social issue when staying in hospital.
No, I didn't offer
Perfect.
social support. I didn't offer that because this is not
You
the
offer
case.
nurse to staying with the daughter, I
Not
think.
nurse, nursing. I told her there is a nursing hours, nursing, nursery. I mean,
Nursery.
yeah,
Nursery, not nursing hours. Yes, nursery. Uh,
nurse
that
to the
he
nursery, yeah,
can.
for hours. they can help. I asked her about the family.
Nursery.
Yes,
Nursery, you mean?
nursery. Yeah, for the
Because
nursery.
nursery.
Yeah, something private, not related to the hospital.
No,
This is by the
not the
patient.
hospital, not the
Yeah,
hospital.
yeah.
But asking because social is
Because
not
I think
for this case.
you said we will provide nursing, something like that.
No. I think she mentioned something to be rearranged by
For
the
the
patient, not
nursery,
by the
by the
hospital.
patient, not
Yeah,
hospital.
yeah. By
Suggest
the patient, yes. Yeah.
not by hospital, yeah. Okay, I
No, it
mistakenly
wasn't.
understand that.
Yes.
Yes.
Mm.
No. Anyway,
Maybe.
it's good to mention. Yes,
Mm.
it's good to mention, Dr. Aisha, because it's very important whenever you have some social issue, not to run for our social team to help. You give him some options from his side or from her side, like family member, like neighbors, especially the reason of, for example, taking care of my cat. So you will not offer social support for the cat care or for the dog. Most of them they have this issue. So the social support here is not in under the surface to help these issues. So the best way is to provide family members or neighbor or friend or whosoever who can take care until she will be at home or she will be fine.
Mm.
This is the take
Other
home
concern
message
is
from Dr. Aisha.
yes.
Yeah.
Other concern raised
Yeah,
by
Dr.
this
Aisha.
scenario, the patient already be angry more, so he will tell you that what let me know is that if another patient come in ER, you will not let me delayed again like that. And what if my condition deteriorated? And he will ask you also, I need to go home, and then when you arrange, I'll come back. And
Perfect.
yes, he will also tell you if I am not urgent case, why you keep me in hospital? He will reply like that. So all these question need replying to
Okay.
say yes. So
Dr. Aisha, wait, please,
mm,
wait.
mm,
It's very important to mention this, and we are learning from these sessions. This scenario was for Dr. Maida, right?
yes.
She was the candidate. Can you please repeat this concern one by one, and let her answer it or answer them? Okay? Sorry,
Okay.
Dr. Aisha. I put you a lot of load.
If she are willing, Dr.
Yeah, of
Mayada.
course.
Yes, yes.
Why not? Yeah.
Okay,
So
doctor,
the first concern, yeah.
what if another
Continue.
urgent case come and you will let me fasting again, and you will take me I'll deliver this message again that is some case urgent, and you will postpone again this camera test.
I highly appreciate this concern. I know I can't guarantee 100% this is cannot happen, but it's unlikely to happen. But I will be quite sure that if this happen, we inform you very early to not keep you fasting all these hours.
Perfect.
Okay, doctor. So if my case is stable and I am not urgent case, why you don't let me to sleep at home? Because your hospital is very noisy for me and I am not comfortable here.
I can hear that. I know it's not comfortable for you, but at the same time, to make sure that you are safe, we need to keep you in the hospital until we have you have the endoscopy done, the camera test has been done, and you have the diagnosis and the management plan. So we are not worried about you, and you are not worried about yourself.
What can be happen,
Great.
doctor? I'll go home and you will rearrange this camera test at the time. I can come at the time.
I highly appreciate that your knowledge about this. Uh, but sometimes things can happen, and you may bleed from your ulcer, and will be very severe if this happened. And at that time, we at that time it will be dangerous for your life, and it's safely to be in the hospital. If anything happened, we can at that time you are around in the medical care, and we can do everything for you to keep yourself well.
So what about my medication, doctor? Because I have regular medication, they stop all for me.
About your medication,
Yes.
do you concern about a specific medication?
Yes, I taking some medication regularly and they stopped them for me.
Okay, so they stop them just because the question is not clear for me. Is it a stop the medication for the procedure or stopped for long term?
Yes, they said to me just fasting today and after the procedure you can take your medication.
Okay, so normally this medication can be restart, and will not affect. Generally, it will not affect stopping the medication for short period of time. It will not affect have a great effect on the continuity of the medication. Uh, as far as you can restart eating and drinking, we can restart giving you the medication.
Mhm.
Okay,
Okay,
perfect.
so
Yeah, thank you.
okay,
Yeah,
so
you have more?
doctor,
Okay.
after this camera test, I can directly go home.
Normally, we keep you for at least for several hours to make sure that you are okay and your symptom is okay and there is no complication happens after the procedure. And when, as far as we are okay, that your health is okay, at that time we can discharge you home.
Okay, don't thank you.
Yeah,
Thank you.
perfect. Yes,
Excellent,
perfect. Yes.
excellent review.
Yeah, several hours. I like several hours. This you have to be in this way while answering any duration. And you don't know, really, is it maybe 10 or 12, maybe 24, maybe 36, several hours. So it's like open, but it would be around this average. So the patient might go home after, and you can continue this sentence, Dr. Maida, by saying, if your condition is okay, and we will let you know if you can go home,
Yeah,
right?
you're
Okay.
stable enough.
Exactly. So if your condition suits to go home, we'll let you know. Okay, thank you. And thank you very much, Dr. Aisha, for raising this concern. This is the way how they are concerning in such scenarios. Dr. Aisha give
But
some
you
example.
can also
Yeah.
add if he is angry, like in first question, Dr.
Okay.
Mayada, just add, uh, I know how this, because he said like that because he is angry. So I know how in anyone in your place will be like thinking like that, and I know how this is stresses for you because he said if another patient come, what I can do, I'll fast again like that. If he is more angry, just explaining that you are empathy with him and they are just uh, understand his feeling,
Mhm.
not
Anyone
not
in
annoying from question. Yes,
anyone in your place can react similar. I can
yes,
understand
yes,
that. Yeah. Mm,
yes, yes, like that.
okay.
Okay, thank you again, Dr. Aisha and Dr. Maida. There is a question, Dr. Muhammad Omar, regarding medication question. You need to ask about DUAC and antiplatelets specifically, because if you want to reschedule, you have to keep them on hold. Uh, I
I think
guess
it's
if you
not
ask,
history, but
Mhm.
if they
yes.
explain in scenario, okay. But in the scenario like that, I heard that the patient have hypertensive medication and they stop it because it's bleeding
Mhm.
like that. So he will ask you, I am on antihypertensive and they stopped me on admission and I am now 2 days not taking my medication. I am fear from anything to happen. So just she
Yes,
will
yes.
reassure him and don't worry, we are monitor your blood
Blood
pressure
pressure.
regularly and if yes, and we will
Mhm.
apply if you need, even if you are fasting, you can take your medication safely. But if you need it, we will inform you and the consultant review your file or your chart regularly to apply you with medication that you need.
Yeah, and it could be also given as injection through the blood channel. There is another option.
Yes, yes. If
Yes, to
but in the
control.
scenario was yeah, patient was hypertensive and already he has hypotension on arrival, so they stopping the
Okay.
antihypertensive for some days.
Yeah. Okay. Dr. Muhammad Ad came in Irish exam here in Ireland. last died. So the patient was on DUAC or antiplatelets, and to reschedule the patient, how you are giving or you are going to give this medication again, and your patient still having bleeding or ulcer. It's risky to restart this medication. However, it's crucial important for him. For example, if he's ischemic heart disease. But again, we are weighing the risk and benefit. If the risk outweighs the benefit, we will hold the medication, continue holding the medication, even the procedure is postponed. If the benefit outweigh the risk, so we will restart it with close monitoring. This is the way how to balance between when to give and when to restart the medication. But to start it with no reason or not no reason, with less indication or high risk, this is very risky for the patient. Okay, so it depends on the scenario. Okay, thank you, Dr. Muhammad Omar, for your questions. Dr. Aisha as well, Dr. Ala, and Dr. Maida, of course. Thank you, everyone, for attending today and for the comments. When anyone has doubt before ending the session, question, suggestion, clear for all. So see you tomorrow with a short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.